And welcome to the introductory lectures for youth engagement. The focus of the lectures series will be on 2030 development agenda and sustainable development goals. We have the honor and the pleasure to invite Nicole Niederberger to be with us and to walk us through the SDG 3. My name is Li Jiayu and I would be the host of this lecture. Let me say a few words about Nicole. She is a pediatric nurse and also a community health specialist. She has been working for many years in the public and global health program and in the managerial functions. Let me say a few words in detail about the places that she has worked. First of all, she has worked on primary health care management in low resource settings and unstable contexts. That means either underdeveloped countries or low or least developed countries and countries with conflicts. She has also worked on social pediatrics, looking at conditions that determine the health of mother and children, and also did a lot of work about health promotion and intervention on social determinants of health. This we know it's very crucial in a way to deal with the budget shortfalls and to reduce the healthcare cost. I'd like to also invite her to say a few words about the places that she has worked. She has worked in the university hospitals in Canton de Vaud of Switzerland, International Committee for Red Cross, and Public Health Neuchâtel, that's the public administration and policy making unit. But most importantly, she has also worked with one of the major NGOs in the health sector in delivering humanitarian assistance, and that's Terre des Hommes in Lausanne. And I will ask Nicole to say a few words to brief us what is Terre des Hommes.
My pleasure to be with you here today. And yes, so Terre des Hommes is a Swiss NGO active since over 60 years now in the area of child protection. Is it in, for example, health programs, can be mother and child health, and in particular, they have expertise in newborn and maternal health. They are also proficient in other areas, such as, for example, youth in justice system and many others. They work in over 30 countries now in those various type of programs that are always there to support existing structure, can be in emergency settings or can be in more developmental settings.
Well, thank you for telling us a little bit about the organization that you worked until 2022. I'd like to switch our attention to today's topic. SDG 3, good health and well-being. What is it all about and why it is so important? So please.
So the lecture of today will be a brief description of what is Sustainable Development Goal 3, what are the targets, the indicators, why is it important, how does it link to what others SDG. We will address a little bit as well the current state of implementation and progress that were made in different countries. And we will as well address some key challenges that are related to achievement of this goal. And we will discuss as well a little bit about how you as youth and adults of tomorrow can contribute to Sustainable Development Goal number 3.
Really looking forward to this. So let me recap. So what is SDG 3 and why does it matter? And of course, good health is essential, but nevertheless, I think it will be helpful to break it down a little bit to see the link between health and well-being.
We will go through that together. So health has been defined many years ago by the World Health Organization as a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. But health can also be defined in a much broader way. For example, it is not seen as a fixed state, but something that is evolving continuously. It's as well the ability to adapt to changes, and health is as well very much linked to the way the environment is capable to adapt to the health condition of individual. Probably there are as many definitions of health that there are of as individuals. I would invite you to think a little bit about what is health to you and how do you see that. And you will see, or you will be surprised to see that there can be quite a lot of different things that will emerge. I would like now to review some key concepts related to health that are very important. The first one is determinants of health and well-being. One very often preconceived thinking is that health is linked to the health system. And we will see here that health is linked to very, very different things that are very much broader than merely the health system. The first one is the red spot in the middle are your individual condition, is your age, your gender, your constitutional factor, your heredity regarding health, etc. The second one is the individual lifestyle factor. Are you eating healthy? Are you exercising regularly? Do you manage stress in a way that protects your mental health, etc.? Then we have the yellow one, that are the social and community network that you have. How do you have friends? Do you have a family that you can rely on? And how do you interact with them on a daily basis? Next one is a little bit more complex. These are the living and working condition in which we all live. Can be your work environment, can be your education, can be agricultural product and food product. In contrast to work conditions, you also have the unemployment. That is a very important determinant of health. Of course, issues like access to proper water and sanitation. And here you have the healthcare services that are as well one of those factors. And finally, housing conditions that are important as well. And then you have that last blue arrow that are the basic general socioeconomic, cultural, and environmental conditions in which you live. Is the type of governance that you have, the political priority, the climate as well. Is it very dry, or in contrary, very hot or very cold? Air pollution here is as well a very important determinant. And all these determinants together build up your potential to health. So if we now want to link them to the Sustainable Development Goal, you will realize that they are very, very much linked to all the other goals. I can propose that you try and make the exercise together, see which of these Sustainable Development Goals can be linked to which determinants of health, and you will be surprised that they are very, very much interlinked. Let's take a few brief examples. This spaghetti noodle plate is the example of determinants of obesity. You see that we have multiple links in all directions: psychological factors, activity environment, food production, business condition, political issues, societal influence, biology, of course, and all this makes the determinant of obesity in a population. Second example, here we have the risk factors of non-communicable disease. Here you will find as well a lot of factors that have nothing to do with health system. For example, your diet is very important. If you use tobacco, if you are exposed to air pollution, if you have a harmful use of alcohol, and if you have the level of physical activity you have. And then I would like to point out a last very, very important example is the link between determinants of health and health equity. So here we have a very good image that shows you what is the difference between equity, equality, and justice. In equality, everyone has access to the same thing, regardless, and to the same services, regardless of what people actually need. In the second one, you have equity, meaning everyone has access to the service they need to be capable to achieve their best possible potential. And here we talk about health potential. So this means not everyone needs the same thing, the same kind of services to overcome health barriers. And in the third, you go even a step further. There is no more need for interventions for equity, because the basic reason for inequality has disappeared. That can be, for example, discrimination, physical barriers, poverty, etc. And so in that context, specific support is not needed anymore. So that was what I wanted to tell you a little bit about global definition of health.
Well, that's really very helpful. Thank you very much. So let me just go into the more technical side of SDG 3. So how do we measure progress made in this field? When look at it, it's almost implicating all the 17 goals themselves. So, I'd be very curious to see what the world has come together and agree on that.
Let's have a look at Sustainable Development Goal number 3, and it's 13 targets and 28 indicators. The first 9 targets are called outcome targets. And they include a various range of topics. For example, we have here maternal mortality. We have preventable death in newborn and children under 5. We have the end of epidemics, for example, of AIDS, tuberculosis, malaria, and combat a number of other communicable diseases. We also want to stop premature death from non-communicable disease. We want to prevent and treat substance abuse, such as drugs or alcohol or medicine abuse. We want to prevent death and injuries for road traffic accident. We want to ensure access to sexual and reproductive health, including family planning and education for everyone. A very important one, we want to achieve universal health coverage, including financial protection and access to quality essential care, medicines, and we finally want to reduce death, illness from chemical and air, water and soil pollution and contamination. And then for each of these targets, quantitative and qualitative indicators have been defined to be able to measure what is the progress that was done. We will not go through all of them, but we will take some example. For example, we want to end preventable death of newborn and children under 5 in all countries and reduce neonatal mortality to at least as low as 12 per 1,000 live birth, and under 5 mortalities to at least as low as 25 per 1,000 live birth. And here, I just want to point you one example of intervention that is validated, evidence-based, and that works, is promotion of support of breastfeeding until exclusive breastfeeding until 6 months and continued breastfeeding until 2 years. So again, here we have an intervention that will have a direct, solid impact on health and that is more nutrition-based. Another example, we want to reduce by 1/3 premature mortality from non-communicable disease, through prevention and treatment. We also want to promote mental health and well-being. So just one word about what are these so-called non-communicable disease. So we have 4 and 1 was added more recently. First of all, we have the whole family of cardiovascular diseases. That is a very important one. Then we have the chronic respiratory diseases. We have all forms of cancer. We have diabetes. And finally, we have mental health conditions. So all these are the non-communicable disease, and they share common risk factors that we saw earlier in this presentation. Another one is the example of substance abuse. We want to strengthen prevention of and treatment of substance abuse, including narcotic drugs, abuse of and harmful use of alcohol. So that's for each and every one of these targets, you have those indicators that will guide all countries, that will have then to translate this into activities, into policies, into commitment, etc.
Well, I'm very much stunned by the fact that we added mental health into the non-communicable disease, although I understand the logic, and I think this is probably one of the direct consequences of the COVID of the last 2 or 3 years. But also I think it's also posed another question, which you talked about before, and saying the dependency on public health systems. And I think, today, the public health systems probably around the world are not fully equipped to deal with this non-communicable disease. And then our families, the communities, schools are all somehow won't be able to sort of meet this particular demand. And perhaps this another opportunity we can talk about this, knowing your expertise and work experience. So let me move to the next question, is how much progress have we made concerning this SDG 3 since 2015 when it was first launched? Of course, it was becoming effect in 2016.
Exactly. And the good news is there has been progress made in some areas. Maternal mortality ratio that has declined steadily since over 20 years, and that is continuing to decline now. You can see in particular in low-income countries, the rate of women who die from pregnancy-related causes while pregnant or within 42 days after termination of pregnancy is really, really getting lower and lower every year. So that's a big success. On the other hand, we have what we already mentioned before, the prevalence of obesity that is a massive risk factor for many diseases such as diabetes and cardiovascular diseases and some lung diseases as well, that is really, really increasing in most of the country, and in particular in some developed country or developing country. So that's a big issue that policymakers have to tackle. Next example is the consumption of tobacco in adults. Here, I just took you some examples from Switzerland, from Europe, sorry. And you can see that there are some countries where you can see a real decrease in a number of adults who use tobacco on a regular basis, whereas in other countries, it is very stable. That's a typical example of area where policy can make a big difference. When there is political commitment, including advertising, rules on advertising, including taxes, including individual services that are provided, there can be really a lot done regarding this target.
This behavior, yeah.
Yeah. And then we had COVID. And of course, since 2020, a lot of issues slowed down all this good willingness that was seen in many, many countries. COVID infected over 500 million people, led to 15 million deaths. That's, of course, an estimation. Disrupted essential health service in many, many countries. So meaning people who had suffered from other illnesses than COVID could not access healthcare anymore because they were all redirected or disrupted by COVID. So it also really slowed down the efforts for universal health coverage because the emergency was more important than the developing, the continuous developing. Unfortunately, global life expectancy decreased for the first time in many years. Immunization coverage decreased as well, and mental health issues increased as well. As we saw earlier, access to basic healthcare was as well much more difficult, and death from tuberculosis and malaria increased again.
Yeah, of course, now, we are in sort of moving slowly into the post-COVID-19 pandemic phase. Although many developing countries are still, having their ongoing challenges. I was wondering, in these circumstances, what will be the challenge in implementing this particular SDGs, knowing that even in regular times, it has not been easy?
Yeah, you're completely right on that. So the main challenges I can see, as you saw, health is very, very multidisciplinary. Needs a multidisciplinary approach in order to be efficient. So it's a real proper approach of health in all policies, meaning in every decision that is taken for a population, is it work regulation, is it air pollution, is it minimum wage, is it etc. We always have to look at the health side. How does which decision affect health, and take that into account. This can be a real big challenges for the coordination at the state level. Of course, you will as well have a contradictory sometimes motivation. Some people want to protect more economic values, whereas others struggle to put health issues higher on the agenda. So that's one of the big deals. The other issue we have, a big amount of the world population do now have access to a good health standard and good living conditions that allow them to have that good health standard. But on the other hand, we also have many people that do not yet have access to those minimum conditions that allow good health. So a very important step will be that leave no one behind approach. And that's where equity that we mentioned earlier is a very important one. Some people will need more support. Poor people will need to be supported in many ways that they can access the same level of health than more wealthy people. So that's an important one. Of course, what we already saw is COVID slowed down results and stopped even a number of things. And we now have to, again, put things into move so that we can progress. And last but not least, and it will affect, we already know it will affect the next generation. It already does affect many populations around the world now, is the climate change. It is a severe threat to health, and solid, massive intervention on those specific sustainable development goals are important to take as well in order to protect health.
Well, with this mixed good news and bad news, is there good examples in implementing SDGs so all individuals, all persons, regardless differences, can enjoy better health and better well-being?
I will give you at least one good example. There are many more, but one is an important one for me. On this world map, you have the progress in universal health coverage between 2010 and 2019. And you can see the more darker the area become and better is the coverage. So there is still a lot of progress to be made, but you can see that in many countries where in 2010 the coverage was not that good, that it's becoming better and better. As an example, Morocco is now doing a big reform of its health system, extending the insurance health coverage to the informal sector, which is very important, because in many countries, a big number of the population are working in that informal work area, and therefore do often not have access to adequate health coverage.
Yeah, or other forms of social protection.
Exactly.
Indeed, that's very exciting, especially knowing Morocco and its historical background and development. So, lastly, I would like to ask you what actions that young people today and adults, as you said, tomorrow can do in order to promote the actions so that SDG 3 could be achieved.
Well, the future of the planet is, of course, in the hands of youth, and they have everything to do. But what they can do now, I think, is remember all the determinants of health that we spoke about, and how it is locally, how do people have access to clean water? How is the equitable access to education? What are the main issues regarding mental health in your school? You don't need to go, or in your family. And what is it that you can do locally, and support and develop initiatives at the small level in your communities. The multiplication of those initiatives is a very important driver of health, and health is first and foremost built locally with people that are living in a given community. And of course, you do have impact on your own health. For example, when you make healthy lifestyle choices, when you go to school walking instead of taking a taxi, when you make sure you eat enough vegetables, etc. So that's as well something very important. And the last thing I wanted to mention here is be involved, participate. Not only will you then be able to support and develop the initiatives in your community that we already mentioned, but the social cohesion and the sense of being part of a community and the solidarity and the self-esteem that comes out of this is a massive, very important driver of good health for you and for all the people near you. And that's something that you can do at your school level. You can work on health promotion at school. What are the issues in our school? Are the learning conditions okay? Is everyone integrated? What are the difference? Are there difference that we should mitigate, for example, between boys and girls? Are there people that do not have a lunch? And how can we address this? All these issues are really things that will have their impact on health.
Well, thank you, Nicole, for a very excellent lecture on what can we do about SDG 3 and what SDG 3 is all about. And I'm also impressed with the positive energy that you put into your recommendation and suggestion to the young people. And I'm sure, you know, they will pick it up and take actions accordingly or along that line of thinking, and by promoting health equity for everyone and by doing everyday things differently that would contribute to the health outcome. So I want to thank you again for being with us and look forward to our next conversation.
Thank you very much, Licia.